To create a worksheet for pelvic ultrasound, go to PACS work list, refresh the work list, and select your patient. On demographics page, under study template, make sure pelvic ultrasound for Gyne is selected. Tap next to go to previous imaging page. If there is no previous imaging to compare, tap next to go to findings page. If there are any SR measurements available in the PACS, Katiba will automatically import them and alert us that import SR was successful. We can also initiate this process manually. Before we enter the findings, we need to enter relevant information in regards to pre- or postmenopausal status, LMP, and whether EV was performed. Once we have entered this information, the tabs for uterus and ovaries will be unlocked to enter the findings. Let's start with the uterus. The measurements of uterus, fibroids, the thickness of endometrium, and the length of cervix are all imported automatically from PACS. We can add other information such as orientation and morphology by selecting from the drop-down menus, or we can simply enter them manually. Let's continue to ovaries. Measurements of ovaries and follicles are automatically imported from PACS. If the ovary is normal, we select normal from drop-down menu and we are done. For the left ovary, let's assume that there is a hemorrhagic cyst. From the drop-down menu, we select Other to describe the findings. First, we select the location of findings. In this case, the hemorrhagic cyst is within the ovary. Next, we categorize the findings as physiologic or benign. A physiologic finding is a follicle or a corpus luteum cyst. Benign lesions are lesions such as simple cyst, hemorrhagic cyst, dermoid, endometrioma, para-ovarian cyst, hydrosalpinx, and peritoneal inclusion cyst. If the lesion does not fall into the physiologic or benign categories, then we select Other category to use standard descriptors. The standard descriptors include lesion type, echo pattern, the features involving the inner wall and the outer contour, vascularity, and shadowing. Because we are confident that our case is a hemorrhagic cyst, we select it under the benign category. Next, we enter the size of the lesion. We also have options to add additional information to the cyst. Let's select that it shows reticular pattern. Next, we enter the info regarding free fluid and ascites. Let's select that there is no ascites, but there is free fluid in the cul-de-sac. If there are any other information that we want to add, we use the Other tab to enter the information. Once we have entered all the required information, the button for the next step will be enabled and we can tap it to continue to select between worksheet and report. Tech worksheet is already selected for us, so tap Finish to preview the entire worksheet. If we are happy with everything, we tap the Export button to send the worksheet to PACS.